Welcome, ladies and gentlemen, to sqadia.com. My name is Mohammad Osama, and we are talking about nutritional disorders, and specifically in nutritional disorders, we are talking about the fat soluble vitamins. So, in this lecture, we are going to talk about fat soluble vitamins, including vitamin A, vitamin D, vitamin E, and vitamin K. We're going to talk about their function, we are going to talk about their dietary sources, and we're also going to talk about the different conditions which are related to them, either because of the depletion or excess of these vitamins. So let's start off with fat soluble vitamins. It includes vitamin A, vitamin D, also known as calciferol, vitamin E, also known as alpha tocopherol, and vitamin K. So the deficiency of these vitamins may result from malnutrition and, more importantly, intestinal malabsorption, pancreatic endocrine insufficiency, biliary obstruction, all of which are associated with poor absorption of fats because these are fat soluble. So absorption of fats is very important for their absorption into the body. Secondly, excess intake can also result in different type of diseases associated with fat soluble vitamins, which results in hypervitaminosis and which leads to vitamin toxicity, especially with vitamin A and vitamin D. Now, let's look at a brief overview of these vitamins. So we have the vitamin A, vitamin D, vitamin E, and vitamin K. All are fat soluble, and vitamin A has its role in vision, reproduction, bone health, immune system, and skin integrity. Vitamin D has its role in bone strengthening and bone integrity, calcium absorption, and immune system. Vitamin E has its role in immune system, and it also has a role in flushing the toxins. And vitamin K has its very important role in bone clotting as well as a role in bone health. So let's start off with vitamin A. It is termed for a group of compounds called as retinoids with similar activities that are provided by animal products such as liver, egg yolk, and butter. Also, for vitamin A, we can use plant sources such as carrots and green leafy vegetables, which supply beta-carotene, which is a precursor for vitamin A or retinoids. On the other hand, these are essential. Vitamin A is essential to the maintenance of mucus-secreting epithelium, and a derivative of retinol is a component of visual pigment rhodopsin as well. So it is also very important for vision. So vitamin A deficiency results in because of a dietary deficiency or either malabsorption, which is related with fat malabsorption or abnormal absorption of the fats. Vitamin A deficiency can result in different type of manifestations such as night blindness, which is because of insufficient retinal rhodopsin, as we already discussed, which is actually a derivative of the retinol or vitamin A. So that is very important that for visual integrity, there should be a regular supply or a sufficient supply of vitamin A. Secondly, other ocular abnormalities can also result because of vitamin A deficiency, such as xerophthalmia, which is also known as dry eyes, as you can see in this picture. This is an example of xerophthalmia. It can also lead to blindness, and keratomalacia, which is the corneal softening, as you can see in this picture. Another clinical manifestation of vitamin A deficiency is squamous metaplasia, specifically of trachea, bronchi, and renal pelvis, also associated with renal calculi, also known as renal stones, and squamous metaplasia of conjunctiva and tear ducts as well. Now, on the other hand, a deficiency of vitamin A is also a problem, but an excess of vitamin A is also a problem, also known as hypervitaminosis A, which can result in alopecia, which is actually loss of hair from certain parts of the body. Specifically, if you look at the scalp here, there is actually loss of hair from certain parts. Other than that, there is hepatocellular damage as well as bone changes because of hypervitaminosis. Second, a very commonly known vitamin, vitamin D, which is taken as in the form of different types of supplements as well, very commonly. It is synthesized in the skin in the presence of ultraviolet light from the precursor, which is known as 7-dehydrocholesterol. Dehydrocholesterol. So it is very important that there should be an exposure to sunlight, in the absence of which vitamin D cannot be produced. So exposure to sunlight is essential, and it promotes intestinal calcium absorption. So calcium is, which is a very important constituent of muscles, and it has also a very important function in the bones. So it is essential for both muscles and bones. So it promotes the absorption of calcium without the vitamin D, which cannot occur, and mediated by calcium binding intestinal transport protein, as well as intestinal phosphorus absorption, because calcium binds with phosphorus and makes calcium phosphate. And as we already know, it is actually the part, calcium phosphate is actually the part of the you can say non-organic component of the bone, or mineral component of the bone, which consists of calcium phosphate and calcium carbonate. So that is how it also enhances bone calcification. On the other hand, vitamin D deficiency results in rickets in children and osteomalacia in adults, which is also known as softening of the bones. So due to deficient calcification of the osteoid matrix, either due to the deficiency of calcium or malabsorption of the calcium, which occurs because of the vitamin D, resulting in osteomalacia in adults and rickets in young children. So it can be caused by either malnutrition, intestinal malabsorption, or inadequate exposure to sunlight, because for the production of vitamin D, UV presence or ultraviolet light presence is necessary. On the other hand, liver disease can also occur because impaired active conversion of vitamin A to the 25-hydroxyl form, which is the precursor of the active vitamin D, also known as 1-alpha-25 dihydrocholecalciferol, which can result in vitamin D deficiency. Renal diseases, it is also associated with renal disease in which there is an incomplete synthesis of active vitamin D, and vitamin D resistant rickets, which is actually a hereditary renal 1A hydroxylase deficiency. So if you try to cover that up with vitamin D supplementation, so those type of children would actually not respond to that. So we talked about rickets. So what are the actually the clinical signs and symptoms of rickets? So there is actually a protruding forehead, large head, pigeon chest, curved humerus because of softening of the bone, kyphosis of the thoracic spine, as well as the other parts of the spine as well, depressed ribs, enlarged epiphysis at the wrist, curved radius and ulna, once again because of the softening of the bones, protruding abdomen, curved femur, curved tibia and fibula, once again due to softening of the long bones, and enlarged epiphysis at the ankle as well. On the other hand, in osteomalacia, there is actually, you can see this is the normal bone and this is soft bone because of the lack of the mineral content such as calcium carbonate and calcium phosphate. Now, on the other hand, or on the other extreme, excess intake of vitamin D can also result in hypervitaminosis D, which results in growth retardation. And it manifests in adults by hypercalciuria, nephrocalcinosis, and renal calculi, also known as kidney stones. Now, vitamin E, on the other hand, also has many biological functions, including its role as a fat-soluble antioxidant. So that is why it's very important. And its deficiency is rare in humans, but can occur as a consequence of abnormalities of dietary fat absorption, because it is fat-soluble vitamin. So if fats are not absorbed, then it can lead to vitamin E deficiency. And diet, or you can say a diet deficient of vitamin E leading to vitamin E deficiency, is not as common as compared to the malabsorption of the fats or adipose tissue in the diet. It can cause nerve problems due to poor conduction of electrical impulses along nerves due to changes in the nerve membrane structure and function, which can result in neurological signs and symptoms in patients with vitamin E deficiency. And if we talk about the clinical representation, so we would see that there would be peripheral neuropathy because it has affected, as we've already discussed, the changes in the nerve membrane structure and function. So peripheral neuropathy, myopathies, and ataxia, which is the abnormal coordination, retinopathy, so visual issues or problems can also occur, and impairment of immune responses and red blood cell destruction because it also acts as a fat-soluble antioxidant. Now, vitamin K, it is essential for carboxylation of glutamyl residues in the synthesis of gamma carboxyl glutamyl forms, which is the active form of clotting factor 2, clotting factor 7, clotting factor 9, clotting factor 10, and protein C. Now, these are all involved in clotting of the blood. So if ever there is an injury, so in order to stop blood loss, so these are very important in terms of blood clotting. But in absence or in deficiency of vitamin K, this process becomes disrupted. So the dietary sources include green and yellow vegetables and dairy products, and it is synthesized by intestinal microorganisms. So if there is actually a destruction or disruption of the intestinal flora or the bacteria, good bacteria in the intestine, so that can also result in vitamin K deficiency. So talking about the vitamin K deficiency, so it results from fat malabsorption or alterations in the intestinal flora, as I told you, because of the excessive or abnormal use of antibiotics, because those intestinal flora or bacteria are actually responsible for the synthesis of vitamin K. Secondarily, it is characterized by hemorrhagic diathesis, which is the abnormal bleeding, marked by prolongation of prothrombin and activated partial thromboplastin times, because it is responsible for the formation of the different type of clotting factors, and deficiency would result in abnormal clotting, delayed clotting, or absence of clotting. And the cause of hemorrhagic diseases of the newborn is also because of the vitamin K deficiency. So causes of bleeding diathesis can be purpura, deficiency of blood platelets, vitamin K deficiency, or hemophilia. So this vitamin K deficiency is actually an important cause of bleeding or hemorrhagic diathesis. Hypervitaminosis K, so there is no known clinical manifestation of excess of vitamin K, and that was all about fat-soluble vitamins, and we talked about vitamin A, D, E, and K. So we are also left with one major part of nutritional disorders, which is obesity. So keep on watching sqadia.com for more lectures like this, and thank you very much.